Since Tuesday, we've brought together outstanding panelists from diverse professional fields to discuss three big questions. 1, what are the current impacts of the pandemic on youth? 2, what are the foreseeable impacts of this crisis on this population long term? And 3, what practice and policy innovations have emerged out of the situation that might lend themselves to sustainable efforts moving forward? Our approach to these questions is overlaid by an equity lens. Throughout our discussions, we've sought to focus on the pandemic's disparate impacts on historically marginalized populations, including youth of color, youth with behavioral health needs, LGBTQI youth, youth with disabilities, and immigrant youth. Our stellar roster of discussion participants and our insightful audience's participation have guided us all in beginning to answer our three big questions as they apply to vital environments for youth, especially justice-involved youth, their homes, communities, the justice system, educational settings, and out-of-home settings. All of these spaces were directly, immediately, and likely forever impacted by this pandemic. And this impact has posed incredible challenges and interesting opportunities to sustain the support that children, teens, and young adults need and deserve. As much of the world now begins to reopen, we invite you to collectively imagine with us the future of youth and justice post-COVID. As we do so, let's remain critical. Let's avoid romanticizing the past. The world as we knew it pre-pandemic was far from perfect. Even amidst a dystopian worldwide crisis, racism in the justice system has still found a way to rear its head, as the events in Minnesota and nationwide in the past few days made clear. Let us work to ensure that the new normal, whatever that is, that we're aspiring to achieve, doesn't bring with it the ugly vestiges of centuries past. It is my absolute pleasure and honor to invite Professor John Powell to join us as we explore the racist underpinnings of this pandemic, but also the pandemic of racism, as George Floyd's lawyer aptly termed it yesterday, that plagues much of our justice system. Their impact on children, on teens, and on emerging adults, especially youth of color, cannot be understated. Professor Powell is director of the Othering and Belonging Institute at the University of California, Berkeley. He is an internationally recognized expert in the areas of civil rights, civil liberties, structural racism, housing, poverty, and democracy. The Othering and Belonging Institute brings together scholars, community advocates, communicators, and policymakers to identify and eliminate the barriers to an inclusive, just, and sustainable society, and to create transformative change toward a more equitable world. John Powell holds the Robert D. Haas Chancellor's Chair in Equity and Inclusion, and he is a professor of law, African American Studies, and Ethnic Studies at UC Berkeley. Previously, he was the executive director of Kirwan Institute for the Study of Race and Ethnicity at The Ohio State University, where he also held the Gregory H. Williams Chair in Civil Rights and Civil Liberties at the Moritz College of Law. Professor Powell has written extensively on structural racism, racial justice, concentrated poverty, opportunity-based housing, voting rights, affirmative action in the United States, South Africa, my home country of Brazil, racial and ethnic identity, spirituality and social justice, and the needs of citizens in a democratic society. He widely published in traditional scholarly venues and elsewhere. He is an incredibly frequent public speaker. I think the last CV that I found for him had at least 12 pages listing all of his public engagement. And he's the author of 4 books, including Racing to Justice, Transforming Our Concepts of Self and Other to Build an Inclusive Society. Professor Powell also founded and directed the Institute on Race and Poverty at the University of Minnesota. He has also served as the Director of Legal Services in Miami, Florida, and was the National Legal Director of the American Civil Liberties Union, where he was instrumental in developing educational adequacy theory. Professor Powell led the development of an opportunity-based model that connects affordable housing to education, health, healthcare, and employment, and is well known for his work developing the frameworks of targeted universalism and othering and belonging to effect equity-based interventions. He has lived and worked in Africa, where he was a consultant to the governments of Mozambique and South Africa, and has also worked in India and Brazil. He is one of the co-founders of the Poverty and Race Research Action Council and serves on the board of several national and international organizations. Professor Powell has taught at numerous law schools, including Harvard and Columbia University. Please join me in virtually welcoming Professor John Powell to deliver this forum's keynote address. Take it away, Professor.
Good morning. Well, it's at least morning here in California. I guess it's still morning in New York for a minute. Thank you for the introduction and having me be part of this important conference. So we are actually experiencing some very difficult times. I was meeting with people yesterday from the School of Public Health here at the UC Berkeley, where I teach and work, and they reminded me that we aren't facing one pandemic, we're facing at least two. And I want to touch on both of those and even how they're interrelated. So one, of course, is COVID-19, and across the country and across the world, many people have been sheltered in place or sequestered for extended period of times. As Dr. Lopez suggested, that's changing. Things are starting to open up a little bit, but we're not beyond the crisis. And I think the effects of the pandemic, COVID pandemic, will be long-term. But I also want to talk about the pandemic related to structural racialization, structural racism, and the criminal justice system. And in some ways, these things are interacting and they're creating a particularly scary and toxic space. We're talking about specifically how these structures impact young people, and particularly young people who are also dealing with issues of marginalization because of their race, because of their sexual orientation, or combination thereof. Now we know that COVID itself directly affects young people at a lower rate. And so that may give some people reasons to cheer or reasons to relax. I think it would be a mistake. First of all, we know there's a relatively new virus or expression of virus called multi-system inflammatory syndrome, which actually affects very young children, and it creates inflammation in different parts of the body, including the heart, the lung, the brains, the kidney, and the gastro organs. It is so new that we know very little about it. In addition, though, even children with low rates of infection can suffer disproportionately from the effects of COVID-19. For example, many of those children already lived in precarious situations. And so we have, when their parents are impacted, when their household is disrupted, when their schools are closed, it has a huge impact on those children, in part because oftentimes they don't have the safety net or the network to withstand the shocks this has had to their ecosystem. A young person wrote an op-ed in the New York Times recently. This person was from Generation Z, which is aged approximately 7 to 22, talking about the effects of COVID on their generation. And this is supported by long-term research. And what she was saying is that this would have a long-term impact in terms of jobs, in terms of their life expectancy. We know if you come of age in the middle of a crisis, the tendency is for that crisis to mark you for the rest of your life. And that's not inevitable. There are things we can do to disrupt that, but we have to be very deliberate. And so it's important to understand that this crisis or these crises do not affect all of us the same. They're disproportionately impacting us, even unintentionally. So we're talking about young people who are marginalized more than once, people of color, people who have some kind of disability, people who are incarcerated, the LGBT youth. And when we look at the effects of systems on these populations already, we find they're oftentimes suffering from trauma. And sometimes that trauma is undiagnosed. And in fact, oftentimes one of the reasons for over-incarceration and dropping out of school is trauma itself. So oftentimes that's undiagnosed. So one of the things to be aware of and to put in place is effort to address the trauma. And there's some of that going on. There's the National Child Trauma Stress Network that's trying to identify the trauma associated with both these populations and these pandemics that we're talking about. So one of the ways this is expressed for young people in terms of COVID-19 is what people sometimes refer to as social distancing. The World Health Organization and our institution has actually suggested we stop calling it social distance and call it spatial distance and social solidarity. Now that may seem like a small change, even an insignificant change, given all the things we're dealing with. But young people need social contact. We all need social contact as part of being human. But young people, in particular in the developmental stage, need social contact. And instead of helping figure out how do we maintain social contact while those spatial distance, we simply tell young people not to have social contact and sometimes write negative narratives about them if they actually seek social contact in their own way. So I want to tell you a couple of stories. I have a large family. I'm 6 of 9. And over the last few days, I've had contact with many of my family members. First, starting with some nieces in the Detroit area. I'm from Detroit. And what they contacted me, actually, my sister, their mother contacted me to let me know that 2 of the nieces had contacted COVID-19. It's interesting that the 2 nieces live in Detroit. They're both nurses, and they were working without protective gear. And I'm not just talking about them, I'm talking about how even when we're facing these crises, we don't protect oftentimes young people and young people of color. So in this case, they were being exposed to the virus without protective gear. Their cousin, another niece, who lives in Ann Arbor, is a doctor. She had all the protective gear she needs. So just think about that. So one's a doctor and 2 of them are nurses. The nurses don't get protective gear. Is it because of their status as a nurse as opposed to a doctor? Is it because they live in Detroit, which is a city, the largest Black population of the city, major city in the United States? So we have those confounding factors that expose them to the virus. We were able to get some protective gear in place through a former pitcher at the Detroit Tiger, but there was no government response in an adequate way. More recently, I've gotten calls from my niece in New York. And she has talked about being involved in demonstrations. And what they're demonstrating against, as you know, is another pandemic, that is police brutality and the criminal justice system. And there was some concern. We talked about how does she stay safe and how do you protect yourself? And I reminded her that we are still having a pandemic. And then there's another niece, and I'll tie these together, who's a doctor. And she's very involved in not just medicine, but also in the community. She actually deals with surgeons delivering babies. And she called me a couple of days ago and she said she was going on the radio. And the radio announcer had asked her to talk about why is it that young people in the midst of a pandemic were going out in the streets, violating the social or spatial distance and risking their lives and maybe others. And what we talked about was that because of these two pandemics, what they were really trying to do, they were going out in the streets knowing that there's a pandemic, knowing that their life is at risk, but they were going out to try to save other lives. They were going out to mark the loss of life for George Floyd and many other African Americans across the country. And they weren't doing that lightly. They knew they were exposing themselves to possible harm, but they also felt like there was a harm that was persistent, that was ongoing, that society was not attending to. And they had to sort of step up and say and do something. Now I say that, and I said in my conversation with my niece, I said, instead of knocking these young people, which the reporter who was interviewer was implying that they were somehow being incorrigible, they were violating the rules, they were not being very thoughtful, we should be celebrating. They're heroes. When people do things where they put their own life at risk to actually help other people, we have a word for that, those people. They're called heroes. And so when we think of people who are engaged in essential services, whether it's delivering our food, whether it's serving our food, whether it's oftentimes caring for people, we call those people heroes who are working in essential services. What we oftentimes don't notice is that many of those people, a disproportionate number of those people, are women and young people of color. So COVID is sort of exposing those people to much greater harm. And oftentimes, again, that harm happens without the proper care and protection that we should have. So we need a system change. We need a change where we're not so inclined to sort of punish young people or to disregard their needs. And that's especially, again, true for young people of color. We need to be able to recognize when they're being traumatized by systems that we have put in place that in some way deny their full humanity and their full sense of belonging. We need to express care for what's going on. And we need to recognize that both the millennial generation and Generation Z and younger people run the risk of having their lives truncated and marked in such a way that they will never fully recover. We need to recognize that in terms of the high-risk sectors, 24% of those sectors are occupied by people who are part of Generation Z and some younger millennials, 24%. And what we know in terms of going forward is that not only are those jobs high-risk jobs, high-contact jobs, but many of those jobs will not come back. And so whether we talk about retail, restaurant, hotel, or childcare, we're looking at young people being laid off and the trauma of not having jobs, the trauma of losing wealth. We've already seen in the millennials who are still recovering from the Great Recession, again, hard hit by what's happening with today's pandemic. And so I just want to give you a few facts. One, even though 90% of COVID-19 deaths in February happened between people in the age of over 30, with a disproportionate number being people over 80. 8.1% of COVID cases were teens, and 0.9% was 9 years or younger. The highest mortality rate, again, happens to those people who are over 80. Younger children and infants are susceptible to other illnesses and long-term illnesses. It's estimated that between 42 and 66 million children would fall into, this is worldwide, would fall into extreme poverty as a result of the crisis this year. And we have, because of school closures, we have 1.5 billion children around the world who have been affected by school closures. And again, if you think about that in terms of the United States, that's especially hitting hard for those who are already in a precarious position. Again, I'll tell you another quick story. I live in the Bay Area. I have a granddaughter, and her school closed like most children's schools closed. But her school had access to computer, had access to the internet, so she could continue to actually go to school. Obviously, it's different to go to school online than to go in person, but the structure of her school could actually still function. And when you think about that, that wasn't just something that was good for her, it's also good for my daughter and her husband. It means they could continue to work because they had essentially, school was offering a kind of childcare as well as instruction. Whereas many students, especially students of color in the Oakland school system, did not have access to computers, nor did the school have the capacity or bandwidth to offer classes. And so I have someone who works with me who has a number of children, a single mom, and she basically said she couldn't work. She was overwhelmed by just the demands of her 3 children. And so again, there's these collateral impacts of COVID that we may or may not pay attention to, and they're not distributed equally. At one point, when COVID first started, we first started recognizing, we thought it was a great equalizer. It is not. It impacts people differently because people are situated differently in society, and because institutions actually are designed to help some people better than others. I've already talked about that for young children, including infants, if they're affected by COVID, they can become devastatingly ill. And although the majority of younger children and young people will develop more minor symptoms such that are similar to the flu, they can be an invisible carrier and play a role in terms of spreading. Now, what does that mean, an invisible carrier? It means that you don't have symptoms. You know, it means that you may not have a cold or a fever or respiratory problems, but if you're carrying it, you can expose your family and those you have contact with to the virus. At the Othering and Belonging Institute, one of the projects that we started is to look at what we call the invisible populations that are not oftentimes acknowledged. So for example, we were shocked as a society to find out that the infection rate and death rate was much higher in the Black community than in the white community. Again, we started off with the assumption that COVID would affect all of us equally. And why is that? And there was a debate in terms of the narrative. Is it because of the behavior factors in the Black community or other structural factors? And in our candor, it was probably some combination, but the structural factors were large. Think about the Native American community, including the young people living on the Native American community. One of the instructions was to wash your hands frequently. Between 30 and 40% of those living on the Native American community didn't have access to running water. So even the intervention that was being suggested did not take into account of how we're situated differently. Think about the whole idea of being sheltering in place, which is stay home, don't go out. It ignores the fact that a large number of people are homeless, and the homeless population is higher among youth of color, and especially youth of color from the LGBTQ community. So again, the intervention simply doesn't work for those communities. So all of these things, sort of trying to understand how we appropriately address these issues, require that we disaggregate the data. And at the Institute, we have a project called COVID Disaggregated, and it's trying to look at populations that are largely ignored and invisible, or if they are visible, they're stigmatized. So Also, COVID is happening to young people at the time that they're experiencing large hormonal changes. So the effect on their body, on their psychology, on their mind is actually quite high. And it shows up in terms of toxic stress. Young people are oftentimes having mental health issues associated with the stress and post-traumatic stress syndrome. So what's needed is deep change. And the speakers have already suggested that we're into a new normal, and we don't even know where it will land. It's still evolving, but we know it will affect the way we think about schools, the way we think about work, and the way we think about home. It also will affect the way we get support. So how do we actually do that in a way that actually serve the needs of low-income children of color, children who are living in situations where they're more exposed both to the trauma of COVID and to the trauma of police brutality. The YWCA has an effort to address some of these, especially focusing on girls of color. And we know, again, that girls of color are more likely to be affected by the trauma, to be misdiagnosed, to be exposed to violence. 60% of children in the United States have been exposed to violence, crime, or abuse at home or in their communities, 60%. And when you're exposed to trauma and violence for 3 times before you're 11 years old, it has the capacity to permanently restructure the brain. Actually, I should say, I hope the idea of permanent is wrong, but the research suggests that it's permanent. But in any case, it's significant. And the question is, how do we do something both to stop the trauma from the beginning so people are not exposed to it, but secondly, what are the interventions to actually help people change if they are exposed to trauma? And this actually brings us closer to the work that we do at the Othering and Belonging Institute. One of the things we know is that when people belong, first of all, their capacity to resist trauma is greater. That is, the effect of an event is less likely to be traumatizing if you are in a space where you belong, where you feel like you're counted, where you feel like you're seen. And part of belonging is just that, is to be really seen. There's a South African word called sabalonu, and it's translated, I see you. It's also translated, the God in me sees the God in you. But for many young people, especially young people of color, they don't feel seen, so they don't have that network. Also, when you have trauma, the ability to respond, to rebound from trauma is largely dependent on whether or not you have a sense of belonging. And again, the populations we're talking about oftentimes don't have that. There are some efforts. One of them I want to mention is the trauma-informed care that's happening out of Montana, focusing predominantly on the Native American community. That community itself, and particularly young people in that community, are heavily traumatized. Native American community has the highest suicide rate among young people in the country. And there are some complex reasons for that, but we can interrupt that. So there are a couple of other programs I want to mention. One is Caught in the Crossfire in Oakland, which is hospital intervention for young people. Then there's Healing Hurt People out of Philadelphia that deals with trauma and post-traumatic stress syndrome. There's a program in Santa Cruz that focuses on Latino children and helps them deal with the disadvantage that they're exposed to. Let me close by saying a couple of things. Many of these programs, I applaud them, they do great jobs, but many of them are after the fact. The young people are already exposed to violence, to trauma, to being othered, to being disregarded, and then we try to heal them. The obvious question is, can we stop the injury before it occurs? And again, as your speaker suggested, there are going to be radical changes. We don't know what those changes are going to be, but the world is going to be different. We're all still reeling over the death of George Floyd and many other people being affected by the demonstrations in the United States. What is the proper response? It's hard to say, but just give you a couple of examples. In Los Angeles recently, the city council has voted to take between $100 million and $150 million from the police and put it into the communities of color who are hard hit. In Minneapolis, the city council there is exploring the idea of disbanding the police altogether and starting over again and having police that actually work with the community instead of dominate the community. We don't know what's going to happen with COVID, but what we do know is that in terms of trauma, in terms of pandemics, it is at least as important what we do at a social level as what we do on a medical level. And this is a chance to sort of look at vulnerable children, young people, and make sure that we pay attention to them and that we put systems in place to understand and respond to their needs. That requires getting good data, that requires listening, that requires involving young people themselves. And I'm pleased to see that some of the work that's being reflected in this conference is leaning in that right direction. Thank you.
Thank you, Professor Powell, for your introspection and for your thoughtful and quite thought-provoking, rather, remarks. Thank you very, very much for being here with us today. Much appreciated.
Thank you for having me.
All right. Our next step here, and I'd like to highlight some of the points that Professor Powell made with respect to data, is this need of disaggregating what we understand and to stay on the collection of data to inform policy and the response moving forward with respect to the pandemic, but frankly, with respect to anything that requires our knowledge and sensibility. I think that throughout this forum, we talked a lot about data as a tool of accountability, but we also created some space for the creation of qualitative data moving forward as we are all caught in the situation of not knowing how to measure things yet. So the role of narrative and qualitative data in informing how people are feeling the effect of the pandemic, and especially people who are in vulnerable situations at this point. So thank you, Professor Powell, again, for your remarks, for your thoughtfulness, and for getting us to think more deeply about all of these issues.
Yeah.
I also want to express our continued thanks to all of you who have stayed with us throughout the week and who are staying with us here today. As we approach the start of this last panel, I'd like to note that this forum doesn't end here. In the next weeks and months, we will remain in touch with those who registered to continue this conversation in different media. And we hope very much to be able to gather again in a few months and to take stock of the opportunities and developments that might emerge from these discussions. I'd like to invite you all to visit the Othering and Belonging Institute's website. I do that often. There's always something new there, including, I think, a very interesting dashboard on the prevalence of COVID at this point in time and its relationship to race. So I will ask my staff to put that, that link in the chat box so everybody has it available.
And
I also-
Lopez, can I just mention, we also have a public event on Monday
Yeah.
that dealing with COVID and race. So I'll try to, if you go to our website, you'll see the link, but it's open to the public, it's free. So if people are available, we'd ask them to join in.
Wonderful, Professor Powell. I'll be sure to attend. Thank you so much for that. I also would like to ask you, I've seen that there's a question here in the Q&A, if you would be able to share with us again the African word that you mentioned earlier, and
Yes.
perhaps teach us how to spell it. There's a
Yes.
lot of interest in that at the moment here.
I'm going to look it up to make sure I get it right, but it's called Sabawanu. It's a Zulu word, and it means, again, has many subtle meanings. It means I see you. Another way of saying it is we see you. And the you that's referred to is not just you that's right there. It's also your ancestors, all those before you, and all those coming after you. So it's basically saying, I see your whole person. And the response oftentimes is that I am here. So I see you and I am here. And there's a lot of good research suggesting that when people are fully seen, when people fully have a sense of belonging, their health indicators go up, they perform better in school, they thrive. And so oftentimes marginalized people are viewed, they're watched, but they're not really seen. To really see someone really requires that you listen to them, that you resonate deeply with their dreams and their pain. And the way you spell the word is S-A-W-U-B-O-N-A, Sabawanu.
Thank you. Thank you for that. I'm a linguist by training, so my mind went to many places here in the power that language has to create culture, right? And this idea of seeing people and integrating and othering and belonging in virtual spaces is something that would interest me in terms of thinking further about all of this. But I will pick up that conversation with you offline at another time. So thank you again so much.